Hello, my good friends. Me and Marcie here.
Good morning.
Good morning. It says morning here.
Well, I'm not sure when you'll watch it, but...
Exactly. And then what about those that are not in time?
Yeah.
Oh, those are living in the now. They don't even know what time it is because there's no time in the now. Oh, we wanted to come and just converse and let you know we're still alive.
That's right.
I did 4 videos the other week and they're just now stringing them up. For some reason it's so hard to get our videos up, and it's only, I think it was one is an hour and a half, 2 hours at the most.
Yeah.
It's hard to get them up for some reason. It's like, I try to get them in a row because it's been a busy summer. And,
yeah. Well, you have had one heck of a summer.
Oh my God. Well, you have too, because you've had some cases here recently that are just neat as all get out. I thought the one case where the lady is now walking is very impressive. From what?
I'd have to go back and reread her story. This is not a client that has actually been to us or seen the office, but people reach out to me all the time telling their stories. And she's tried everything. Finally heard about us, was bedridden for roughly 3 years, and is now up and walking again.
Yeah, we're going to ask her if we can share the video. Yeah, that's
she sent a video. It was a video of her particularly starting to walk. So we'll see what we can.
All get out. It gets your heart when you see someone that has not been able to walk for a long time, then turn around and start walking again. That's a big deal.
Yeah. We do have a video that we're going to be doing after class with somebody on that will be in town, and so that'll be an exciting video.
That'll be exciting. Yeah. People have to realize that there's regeneration.
Yeah.
And that this whole idea that once you're afflicted, and afflicted meaning you created this, then it just becomes an understanding of how you created it and how you uncreate this. The cause and effect thing. Because we look at the allopathic concept of diseases, there's no understanding of them. Half the people can't even pronounce the names. They all deal with inflammation.
I was just working with a case the other day on fibroids, and the doctor said, well, we have no idea what causes them, but, to be a doctor, you should understand the causative factors behind.
This is my heart. If you don't know the cause of things, then you shouldn't be allowed to treat them with toxic pharmaceuticals, because the death rate from that is astronomical. And then on top of that is the harm to tissue in the body, the people's lives that have been destroyed through. They didn't die, but like the lady still in my heels, things like that, where it just burned her inside out. Those sort of stories are monumentally painful.
Yeah.
And so there's literally millions, tens of millions of people that fit that category that have been severely damaged by pharmaceuticals. Botanicals do not work in that way. The Creator did not make. You could argue that it did, and I would agree.
Well, you can take anything and make it toxic.
Anything, exactly. Anything, even botanicals. You can bring arsenic forward, even though it's a family member in chemistry. Bringing it forward and treating it like a good friend could kill you.
Well, the arsenic that's in some of the seeds of the fruits and stuff is particularly there to fight off, just like we have antibodies to fight things off. It is to help the plants fight things off, and in some respects for us as well. It's just the overabundance of it.
I juiced an X amount of time in my life, but I've never been an extreme juicer. I mean, we've had the juice man here, we've had all kinds of people, and there's those out there that are extreme juicers. I've never been an extreme juicer because of the time involved and that sort of thing, and I like that fiber to get into my bowels and stuff like that. So I've always enjoyed the eating of the fruit as opposed to juicing it and stuff. And so when you start taking
now, see, I'm the opposite.
You like the juices?
I love the fruits, don't get me wrong, but time for me, I am always on the go. So it's much easier for me.
Just to juice and drink?
Juice it all, and then throughout the day I'm just drinking.
Drinking. Yeah, someone gave me some fresh squeezed Concord grape juice yesterday and stuff. It's like, my toes were curling.
I have seeded organic Concord grapes on my desk right now.
Do you really? Oh my God. You know, the little seedless.
Mm-hmm.
Yeah, I still have some in my refrigerator.
Yeah. I have some in my freezer. Now let me tell you a treat. I put these, they're called jammies.
Jammies.
They are amazing. They are seedless, but they are organic Concord grapes. I put them in the freezer. I get them out. I put them in my blender. I add a little bit of coconut water and 1 date.
Oh, that would be sweet.
Now some people are like, well, they're too sweet anyway. But I do it for the iron. I do it for the iron and stuff, and dates actually help me filter better and that kind of thing.
Yeah.
But you do that on a hot summer day because it makes a grape slushy. Ooh. And I'll tell you what, for you mothers who are struggling,
oh
exactly.
My God, that would be good.
For you mothers that are struggling with getting your children to do fruits and stuff like that, you pour that into one of those icicle pop sickle things, and you pull out one of those and give to them. You aren't going to have a problem getting them to eat it.
Yeah, you know, I think more and more. Matter of fact, let me grab this book while we're talking, because, Jello, I have it. I must have put it down somewhere, but I was going to bring it out. She's got the natural way the children's book is done, and we now have it available. And I wanted to talk about it. Maybe I have it still in my truck, but I wanted to talk about her book because for children, you're getting into all these type of juices and stuff and make them fun stuff.
Absolutely.
And then this book that's out on the nature's way and introducing children to living foods.
Yeah.
And iridology, she has a chapter on iridology in there, teaching children how to read eyes. I mean, the wave of the future on this planet, it could be so super cool.
I've talked to so many people recently that are like, things are in the wind and it's changing. So
that's because of all of them. It's because of all of us hitting that and standing up for truth and not being blown over and standing up for truth.
Yeah.
Because if you don't stand up, guess what? Right now the battle's afoot. We talked about that, the negative and the positive, always going at each other. Yeah. And that's what's going on in creation here right now. And you can see that. The negative forces are strong right now. So whatever cycle it is, it is. Yeah. In Hinduism, it's the golden age of the Kali Yuga. So those that are Hindu knows what that means. And so this is basically in that view, this is the best of the negative times. So that's not good. But I think that you have to understand there's those sent to this area to help bring changes. And they're involved right now and changes are happening.
Yeah. It is, let's just put it this way, the next few years are going to be not only interesting, challenging, but very exciting.
Very exciting. I tell you, the cases are incredible. Yeah. When I saw this lady take her first steps after a few years, it's like, oh man. You know, it's like, what's her name? We had out there in our halfway house thing, where she was walking for the first time. Yeah. And it's like she's been down for a long time. That was the Garrigs, but she was even like couldn't talk, couldn't sing.
Toes were curled.
Toes was curled. What happened in 5 months?
Yeah.
5 months. She was pushing her stroller. Her feet were out. She was talking and singing and talking better when no one was around. Notice that they filmed her.
But exactly.
Just saying.
I want to say. I was talking with, I think you yesterday on this, and I was talking with another friend of mine about this the other day. When you start moving or are allowed and allow movement through you, and you start moving into the place that God has for you, whether you're a person, an individual, a company, a ministry, whatever that is, you have to be prepared for the backlash of the negative.
Yep.
It will happen. You can call it the spiritual, you can call it the negative, you can call it
the devil, whatever you want to call it.
Exactly. You have to be prepared because you will come under fire. I remember the very first time, it wasn't the first time, it was the second time, that my husband and I down here started moving into marriage counseling as far as we started working with couples. 2 weeks in, I mean, we loved this plan. We loved the people. They loved us. But 2 weeks in, our marriage was attacked like you would not believe.
I bet.
Our thought processes, our emotions, our feelings for each other, everything came under attack. And literally by the end of this class, we weren't talking divorce, but we had, I mean, it was like there.
Yeah.
And it was like, wait a minute. We obviously jumped into this before we were prepared, so we pulled back and started working on the marriage more, so that when that time occurs again, if it does, who knows, maybe God's like, maybe that's not the job for you. But I'm just saying, the closer you get to the breakthrough, the more hurdles are going to be placed in your way, because somebody out there doesn't want you to succeed.
Well, this ties kind of into our conversation this morning and a little yesterday about everybody's different. Everybody's different on the spiritual level. Everybody's different on the religious level. Everybody's different on the health level. So you have some people that can't even eat fruit.
Right.
And you have other people that can just suck it down.
Yeah.
And it's hard to judge that because some people are much more genetically involved in terms of cellular weaknesses, and then some people are so much more lymphatically involved.
Absolutely.
And brother, you know, you can get so bad, and some chose to go allopathically a lot of their lives, so they took a lot of antibiotics. Here's another gentleman I was talking to yesterday that was filtering, and they put him on Cipro because they thought he had an infection. And I laid into him and let him know, you know, Cipro is a killer, number one. For the FDA to allow Cipro still on the market, so people at the FDA probably should sit in jail for a while and contemplate their navel of why we don't allow antibiotics that kill.
Yeah.
This is an antibiotic that kills, like vancomycin. It's a killer, and it's factual, and yet they do nothing about it.
Well, they consider Bactrim a little less than that, but still, I've had so many people have a reaction to Bactrim that it was unreal.
I know, but you're getting into like amoxicillin, you're starting to get into some more of the softer type.
Well, now we're going to preventative. So things like oral surgery, which I just had done. They want you to do a week's worth of prescription antibiotics for preventative.
Well, that brings up the idea, did Barry, when he had his implants, go on antibiotics, and that's what took him down, you know. So
now I did stuff for myself the whole 2 weeks before my surgery to prepare, but it was all natural stuff. I didn't do antibiotics. I didn't do anything.
But here's the thing.
You know what? This has been, I'm 5-6 days past it, and I had them relook at it to make sure, and everything's fine.
See,
and I'm a diabetic, which they consider, you know, a little more susceptible to bacteria.
Well, now just think about this one, though. All right, because this is, and I did a video here last week on that, about our little friends, right? And dentistry is a big place in that, too. You see an abscess, bacteria, get them, right? The sadness of that thinking is that you want the bacteria. You want the cleansers. They're not after your friggin' teeth and your cells. Bacteria are not after your cells of your body. That's a macrophage thing. It's after the sewage in your mouth. Sewage that's in the interstitial spaces of your gums. And that's what they're after. So if you get bacteria, by killing your bacteria in the mouth, you also kill it in your lymph nodes, in your gut, so you mess up everything. And that is insane. Medical doctors, including dentists, do not understand. It isn't about bacteria. It is about acids in your lymph system. It isn't bacteria that's chewing on your teeth.
I've had 2 dentists recently tell me it was the acids, not the bacteria.
Oh, I see, they're learning.
So
my dentist was learning. Absolutely. He'll now go lymph acids. I said, now you're getting
that conversation with them and teach them.
Exactly.
That's the thing. We are starting to teach them.
Exactly.
And that's neat to see.
You can't take nature and kill it. You have to understand it. And by seeing bacteria present, when you see a glob of acid and proteins, hello, that's what they do. Whenever you start to necrotize it, you start to wear down the magnetics of a protein in a basic way, you're going to pull bacterium to you. It's a call of the wild. You're going to emanate the odor from your body.
Well, I mean, that's what has to happen.
It does have to happen. I mean, they're in there to clean it by killing them, and they blame it. It's like flesh eating and all this. You have to understand. And MRSA is another good example. It's just a strain of bacteria that said, I'm not going to take any more antibiotics. It's easy to get out of the body if you get rid of their food source. And that the fear behind that, if you look at antibiotics, that's when everything started to go downhill in the health of humans.
Well, look at it this way. You take a stagnant pond, and you got mosquitoes everywhere. But what happens when you start to dehydrate that pond? When you start to drain it, or nature does that for you? But what happens? The mosquitoes disappear because their food source left.
Exactly. Whenever you bring in the living and the fresh, and that's what we're doing in health, is just bringing in the living, because everybody's used to eating the dead. So you're used to eating the dead animal meat, for example, because when you get into bacterium, they're nitrogen people. They're after your proteins, waste. When you get into carbon waste, what's the little creatures for carbon waste? They grow on you all over the place. Moles, fungus. That's your sugars. That's your carbon. Your nitrogen is your putrefactive. Fermentative is your carbon side. That's your another little creatures. We're always trying to get rid of them, but you're the host offering up the most. And it's like you've got to fix things like fermentation issues in the body, proper adrenal cortisol issues, also proper food combinations to keep down fermentation. But there'll always be some low-level fermentation in the human body. The same thing with some degree of putrefaction, because amino acids will always be a part of any structure. So you always have minor degrees of that. But this idea of killing bacteria and going after that, the infection and this stuff, this is such the hype. Infection, acidosis, and acids will rip you apart. Look at it. Look, we're talking about people that lost the ability to talk, to walk, to do anything because of what? Acids. So it's a big deal to understand that side.
Absolutely.
But this thing about everybody's different. And different in detox. You never want to compare yourself to another in detoxification. There are some of these young people that are tearing it up. They're going on and they're going to 10-day dry fast and crap like that. God bless you. But there's others that have used antibiotics to the point where there's no more bacteria in the body to help break down acids. So you're full bore 3 pH pain. That's your RAs, that's your all your arthritis, that's all your fibromyalgias, your lupuses, your Lyme's. You guys have taken so many antibiotics to treat these conditions that don't exist. And of course they don't help, do they? No, and they always do it. They always give antibiotics to something that there's no antibiotic can help it. They always still do it. And then you're faced with no help to break down acids at 3 pH. You're faced with excessive fungal growth because anytime you go with antibiotics, now the fungals overgrow. So it's a mess.
When I first started doing this, I remember I started breaking out with these little, not a lot of them, but just these little spots.
Pustulas?
No, they were, I would scratch them and they would puff. It was fungal.
Wow.
It was fungus coming out, fungus spots.
Well, you're diabetic.
But I would scrape them. I would scrape them like this. They'd do this little puff thing, and then they just slowly start disappearing. It was just, I thought it was fascinating myself.
Diabetic.
Exactly.
Sugars. I mean, it's all there. But fixing the problem is the best answer you have instead of treating the symptom, because by using the antibiotics, you can literally destroy your health big time. And then, like we said, if you don't have bacterial action in your body and the lymph nodes, you're facing 3 pH pain. That's Coca-Cola pain. And that is no fun pain whatsoever. And then your uric acid pain is probably more like 2.5. Probably between probably between hydrochloric friggin' acid. Because when you're looking, even in logarithms, you're still real close. Because hydrochloric acid is 10 times hotter than your cellular waste. And that's not that much. It's a lot.
It's so hot that the stomach lining replaces itself every 3 days so that it can handle it.
You can imagine. So it's all in our face.
3 or 4. I think it was 4 days. Did I say 4 days?
Doesn't matter.
Anyway.
Doesn't matter because
it just tells you how hot that has to be.
How hot it has to be, the mucosa, how strong the mucosa has to be, the fact that mucus is involved in this. But your human body's not designed For example, if you look at the hydrochloric acid levels, the pHs seem to be the same, but when you look at a carnivore, so to speak, or even an omnivore, their stomach acids seem to be stronger than ours, because we don't necessarily break down bone in the stomach that easy when you take a carnivore.
Right.
So, but then look at what we have to do immediately. You've got the stomach, a small chamber, and immediately outside of the stomach, you've got your duodenum, your small bowel starting. So you have a need to have, what was it, 7.5 pH minimally to activate trypsin, chymotrypsin, and that's to deal with the amino acid side, the protein side, let alone the tyolins, the amylases, and things like that.
Yeah.
And you got to be up there in the 7s to 8s to activate this stuff. So when your stomach is down to 2, think of logarithms. So when you're going from 2 to 8 or 7, that's a lot of distance.
Yeah.
To go from that highly acidic condition that'll chew up tissue to an alkaline side.
If the pancreas isn't working properly and putting the right amount of bicarbonate to bring that up, all that heat that's not gotten to where it needs to be starts burning off the little villi that wiggle, or charring them, whatever you want to call it. But that creates even more malabsorption.
So I'm a cell in the pancreas, or the pancreatic duct, and my job is to produce bicarbonate. One of them. What could influence, what could stop me from doing that? I'm a cell sitting there, cell, structure, function. Remember, cells in your body are structure, function, right? Fluids are just there to take care of those cells, right? So what could hurt me? I'm a cell. What could affect my inability to produce? My memory? Absolutely. Genetics? Absolutely, number one. All right, but let's say I'm pretty good with that. I'm pretty good, I'm strong, right? What could affect my ability to produce? I got blood coming in. Blood's very fluid, very moozy, so that's not really stagnant. That's not going to happen. If blood doesn't get to me, of course, I know I'm done.
Yeah.
Right? So I've got blood. I getting to me now. But what else could shut me down? All right. Anybody ever had a cold and flu-like symptom? And your sinuses start to break loose, and I got talking like this, and you can't smell anymore, and anything like that. What's shutting down your ability to smell? What shut down the olfactories? Mucus.
Yep.
Where does that mucus come from? The mucosa. It is also a great part of the lymphatic system. So interstitial spaces around me as a cell is where that is. And when that space around me, the 75 to 80% that's lymph, gets stagnant and isn't moving, like you were saying, a stagnant pond, imagine there's no movement of that lymph, or very few, because the lymph nodes are swollen and stagnant. So I'm stuck in sewage that is continuing to grow, because the cells around me are continuing to let go.
Exactly.
So what's up? That's what's up. The interstitial spaces, the lymphatic system, that's what's up.
You tell a 9-month-old that the toilet doesn't work and he can't go to the bathroom anymore. It's not gonna work. They're just gonna keep going.
Exactly.
That's why you put a diaper on them. Your cells are the same way. Just because you're not getting rid of the waste doesn't mean more waste isn't happening.
Yeah.
So.
Exactly. Just because you're pooping and not, well, a good example would be a diaper. You throw a diaper on a child, he can't eliminate the waste to the outside world. So just say he's a pooper, and he doesn't like the milk, so he's pooping a lot. So his diaper's getting fuller and fuller and fuller, and the blowback is on his little butt.
Yep.
So what are you going to see now on the little butt? And I use that analogy with urine the same way. You don't get stool or urine off the skin. What do you see? Burn.
Diaper rash.
Diaper rash, burning.
Absolutely.
So what?
Red.
Take that redness, take that inside of you. That same scenario, but against a cell wall.
Yeah.
That's why the cell wall has HDL, which is a coagulation called phospholipids, and it's to protect the cell wall from this. There has to be protection on both sides of chemistry, and if you look at how God did it, you see it right there. Great lymphatic system. Sorry that the allopathic missed the truth of all of life here, health-wise. But this thing about everybody different. Some people are struggling out there to go on a fruit diet. Relax. If you have to. If you can't take the herbs. We don't know, when someone takes herbs, we don't know whether you can handle them or not. 99% of the people out there can handle these quite well. There's grass herbs. They're generally regarded as safe. The FDA is well aware of our company and herbs. They visit our lab once a month. So what would make the difference between someone that can handle, we got babies that are on the herbs, and then others, if they can't even handle one formula, they just freak right out. If you're that sensitive, then we ask you muscle test. You muscle test all the formulas, because you can't blow back on us because we don't know. You have to muscle test, and that was discovered, so God did put that out there for you to go, oh, let me see if I can handle this thing. As you grow spiritually, you will know by feeling the formula and feeling the energy of it and seeing how your muscles feel. Is that making my muscles weaker, or is it making me stronger? And you can tell by just touching something. Oh, are you making me weaker or stronger? You can do it on people too. You can do it on anything.
Yeah.
And that's important because it's just the law of homeostatic energy. And that's all it is.
And we're starting to see people who are coming in who are so weak.
Oh yeah.
So
God.
down.
Adrenal shot.
Yeah.
Yep.
That to even give them adrenal formulas can send them into a tailspin at
Isn't
first.
that amazing?
Because it's kind of like you're trying to wake them up and they're...
Well, it's like gastroparesis.
Yeah.
You can get so bad in the stomach that you can't handle water anymore.
Yeah.
You can't handle anything, including water. You're in trouble.
Yeah.
We have to spoon feed you when you get to that level, and I've had to spoon feed some of my clients that way because you couldn't. They couldn't handle it immediately.
Right.
So you can get yourself into some dark places, but you can also get yourself out of them.
That's right.
All right. And so the time to do it is right now. You don't want to wait. And the more you wait and you're not filtering, the more acids are building up in your body every day. And you just want to get it filled. There's no mystery about it. You're getting your sewer system back online. And if you're the type of person that has to just have salads for a while, then graduate to green drinks, and then graduate to fruits, okay, start at whatever level, but you have to start. You have to push through. It's like an ulcer. You know, you feed an ulcer, but the more you feed an ulcer, the worse it gets. It's just that sort of thing, and you have to understand, you have to push through sometimes.
I just want to reiterate what Robert said. Don't compare yourself to anybody. This is your journey. And at the end of it, you're going to be standing there and you're not going to have mom to blame. You're not going to have dad or husband or wife or anything else to blame. It is going to be you. Did you make that? You have to understand what we are trying to do is educate you to understand you have all authority. And now we're trying to give you the knowledge to turn it around. You do not have to accept you'll have this the rest of your life. You do not have to accept there's nothing else we can do. You do not have to accept you only have 3 months to live. You are being given what you need to change you.
Yeah, you know, that's the whole point. This whole thing of you only have 3 months to live, you only have 6 months to live, boy, we made a lot of medical doctors look like fools, haven't we? But that's the sort of thing where's the positivity?
Yeah.
If you don't understand anything, why are you a doctor?
Yeah.
If you don't understand that, and you're telling your clients that they only have a few months to live, that is, I mean, we just this case after case where the medical doctor got in their face and was rude and telling them they're going to die, and you can't do the herb because it could kill you, and it's like you're already dying. And, I mean, just stupid stuff like this. My thing to medical doctors is wake up, understand you're walking down the wrong road, turn it around, and turn your practice around like a lot of great medical doctors have. We have a lot of medical doctors that have following us and have turned their practices around, and they're curing people right and left where never before they never even knew it was possible to cure someone of that because they were never taught that. And now that they're understanding the lymph system and more about
or even more that know they can't say a lot, but they will nudge you and say, don't know what you're doing, but keep doing it.
But you know what, in my opinion, it is time for each and every one of you to stand up and claim your warriorship. In other words, claim who you are.
Yeah.
You know, this leaf blowing in a wind, some of you are like acting like leaves blowing in a wind. That's the adrenals. Get strong. Get those adrenals strong. Get yourself strong, because each and every one of you are a representative of the divine, of your creator. and you're here to give experiences to that. How do you think God gets experiences with an infinite being like that? It's through its creation, and you're a vital part of that creation. And so each and every one of you are blessed. I love every one of you guys. And it doesn't matter how tall, how short, how fat, how skinny, who cares? That's the fun of it all, is the differences that we have. Yeah. Visiting a place that's all the same, the colors are the same, nah. We love the beauty of individuality. Social consciousness is everything's the same.
Right.
Yeah. Right.
I mean, everybody likes to go on vacation because it's a change in scenery. I mean, that's just, you like differences.
Exactly.
I mean, if you live at the beach, yeah, you love going to the beach, but going to the Rockies is like, wow. Yeah. If you live in the Rockies, you're like, I want to go to the beach.
Exactly, exactly.
It's about the differences.
Well, this is when I say get out of your minds, because it is the mind that judges. It is the mind that likes to categorize, compare, but that's how the mind survives as well. It's not, you can't look at it too negative, but you have to understand how it works and not let your consciousness be pulled into that, your awareness, your attention be pulled into those thoughts like that, judging others and things like that. Look at the beauty of others. Look at the soul within others.
Absolutely. But I also want to reiterate, don't judge yourself too harshly, because when you are being too harsh on yourself, man, I did so good during the day, but I don't know why. Last night I ate something I shouldn't have. And you judge yourself harshly like that, you're adding acid.
I didn't do anything like that.
But when you're negative, when you're down on yourself that,
it's acid.
You're bringing acid in. So you're doing all of this work. Even if you're not good 100% during the day, think about the good you are doing, and allow yourself the freedom to grow in what you're trying to accomplish. Because when you're that negative about yourself, you're nullifying a lot of the good that you're attempting to do. I have more people that run into walls emotionally and things like that than they ever do from the body.
Yeah. Oh yeah.
So,
you know, you can experiment with this in digestion. When you're eating something that you feel is not good for you and you're all stressed and I shouldn't eat it, but I'm going to eat it anyway, and see how you feel after you eat it. Or I know I shouldn't have this, but I'm going to enjoy the holy hell out of this. It just goes down better, you know. And then you go on to the next moment. Don't live in the past. Go to the next moment and be pure in that moment. You know, live in each moment for that moment, and your life will be happy. You'll be free and joyful, and you won't have the dictates of others at any level reduce your ability to be free and enjoy yourselves. And that's why you're here. You're not here to be strict and walk little guidelines and you can't do this because it'll be this, or you shouldn't do that because it's seen as, there's no sin. If you live in the world of sin, you live in the world of religion. And if you live in the world of religion, you have to be careful, because it can reduce your ability to enjoy why you're here. You know, you have action and reaction, and you learn what it is. If you have an action and it doesn't have a favorable reaction, I mean, there's morals and there's all this sort of thing, but how good are morals? I look at people that are supposed to be really moral, and what they are. Look at the priestcraft in Catholicism right now. Serious trouble. The pedophile level is very, very high. What in the heck is going on? That's why I'm saying, don't ever put anybody between you and God, because you are directly coming from God. So you're the end. Jesus said it himself. You're the way. Jesus said it. Buddha said it. Look at what these saints and saviors say about that. And they say that you're the living truth. You're the way. So start looking at yourself as being, like Marcie was saying, the nice loving being, and change. If you don't like what you see, change it. Because I've said this before, who's driving your car? Are you driving your car, your bodies, or is someone else? Is your mind driving your experiences? And your mind is totally conditioned by governments and religions and spirituality and all of it. Is that what you want? Or do you want to be a free being to experience in the moment? Like little children, Jesus said, be as little children. Be free in that moment to play, to be angry, to be sad, to cry, but to go on to the next moment. Essential to do that.
You look at those little kids, though, and they don't stop and think about the next moment or the next moment. They are living in this moment.
Yeah.
If they want this toy, or if they want that toy, or if something's not making them happy or whatnot, you know it. They're not sitting there thinking, well, I'm going to put this off for a little while longer because I don't want to interrupt my playtime right now. You know, that's not what they're
I tell you, though, it's getting younger and younger because you see watches on kids now, so they tie them to time.
I'm sorry, that's sad. I find that so sad. I do.
Tying them to time, you know,
Yeah.
and of course all the other stuff, tying them to time.
Yeah.
And that's locking you into creation, you know,
Yeah.
and you just have to understand that. But that's how you get locked into creation. How do you get unlocked?
Yeah.
There's an article that I think it was Valerie pulled off about a 2-year-old boy with deadly cancer gets an early Christmas from his neighbors. I didn't read this article because there's so much sad stuff out there. We get it. And this is just sad. I mean, when you look at the pictures here, this is sad. All I've got to say is, because he has brain cancer at 2 years old doesn't mean he has to die. If he goes with the medical community, you have 9 chances out of 10 he will. If it's that good of a rate, because there's nothing they can do. You can't attack acids burning their brain with more acids to burn the brain. That it is insanity. It is criminal, in my opinion, and we have to stop killing our babies for what? What's the reason we're doing this now? I forgot. So when you get a baby like this, first of all, you got to look at yourself as a mama. Because the lymphatic system came from you. So you have to understand that you got to get on your lymph system as well as your baby's lymph system. Remember the little baby that had the cancer in the eye, and we got 9 months old. We got that out before they removed her eye. That sort of thing. You can get these acids out of these children, but you've got to get the same thing with us. You got to get their kidneys to filter. You got to go after them. But someone thinks they have jurisdiction over you as the parents. And that is our government. And that's most governments around the world, to tell you the truth. Very few places allow you total jurisdiction over your own children. Isn't that interesting? I'm sure God loves that. So the jurisdiction means that if they tell you you got brain cancer, then you have no choice but to take chemo. It's almost like what would you call it? Almost like the Nazi times when they were killing right here. Everybody goes over there, we slaughter those. I mean, it's like, what? Yeah. It's sickening. Sickening in my opinion. So I don't know what to say about this article. Only that anybody knows any people that are in these situations, let them know that there are help for these poor little babies, and that these babies don't have to die. Yeah. And we give them their last wish and all this kind of stuff. It's like, you want to give them their last wish? Let's get them healthy. You know, it just makes me sick. But that's what's happening.
I had a doctor tell one that the chemo is no longer working, but if you don't take it, you're going to die.
You know, you told me about that one, and that is almost, I think they take a college course on that to learn how you say that like that, because that's what they seem to all tell them. Not working, it seems to be making it worse, but you need it or you're going to die. You know, what? All right. Holy crap, can you spell that? Can you pronounce that?
Well, I could if I got my glasses. Oh.
That's what I'm talking about. What a whopping word.
Myelodysplastic syndrome, bone marrow.
So I am so thankful that I found you and for all the information you give us on all your videos. Thank you. We love you. I tell you, for a medical doctor or any other practitioner, if you want a good research channel, Where do you learn?
Absolutely.
Where do you learn about the body? Look at our people on our channel.
Mm-hmm.
They know about the pituitary. They know about the parathyroid. What medical doctor knows anything
They're
about
starting to learn about the
that?
hypothalamus.
About the hypothalamus. They're starting to-
I have a passion for the hypothalamus. I'm just telling you.
Sure, but that's okay. I mean, you're starting to learn how the body works in ways that they don't on this planet. I mean, look at what they're doing. And like you said, a lot of them are not even calling us, or they're just getting the herbs and doing it,
Exactly.
and they're walking and stuff. Oh.
Yeah.
And that's the beauty of that sort of thing. You read my eyes in February this year, and you did the 14-week protocol. Oh wow! I started the protocol in April. Had some pains in my body for the time I was taking the herbs. I finished the protocol some weeks ago, and I'm happy to tell you that this week my kidneys started filtering. After all that time, and that's scary because you say 14 weeks, and so how many months is that? You know. So when you're looking at that and you're fighting acidosis or fighting a tumor and it's aggressive, that's too long for me. You know, it's like, how can we get you filtering tomorrow? That's in my mind.
Well, I know for me, when I started this, it took me 9 months to see filtration and
Holy
14
crap, Marcie.
on a consistent basis.
Holy crap. I mean, it's amazing that it can take that long. Why? I mean, you know.
Well, you think about it. Remember you and I, do you have a water bottle in here? You don't. I was going to do that little analogy that we had. But let's just say that, they can't see it. I was going to do the water bottle. Remember we did the water bottle analogy the
I
other
don't
day?
have a water bottle.
Yeah, that's all right.
I should in my refrigerator. But.
Your lymphatic vessels should be the consistency of a kind of a watery snot, more like a snot.
Yeah.
But it should flow. But it can start getting thicker and thicker and thicker. Now imagine that you're trying to shove pudding through that same thing, or if that actually hardens even more. We have these people coming with the lymph nodes get hard as rocks, or they flare up, or they get these tumors that are hard as rocks. That's got a lot of calcification in it, and that has to be broke down, and that can take a lot. It can take months to break that down to the point that it can even move in the smaller capillaries that are peripheral. You know, like even...
I showed him the finger.
Yeah. Mm-hmm. Did you really?
Yeah. That finger. I showed him the lymphatic finger.
There you go. The lymphatic finger. I love that. But, I mean, it's just a matter of you got to give your body time to break some of this stuff down to even be able to move it out.
Well, I've been telling about Dr. Pimple Popper. Mm-hmm. And when you see when she cuts those open, and these aren't cysts, she knows better. Cysts are more liquid, more clear. These are tumors. And you see that tonsil stone crap, that white cottage cheese, and you gotta to understand the smell of that is necrotic as all get out. Mm-hmm. And because it's proteins. And I can tell you, it's nasty, nasty, nasty. And that's what Marcie's saying, that thick cottage cheese is what your lymph system turns into when it's stagnant, like your lake that's stagnant and nothing's moving.
Exactly.
That's what hydration is. That's why we bring alkaline chemistry into a highly acidic zone, because this zone has been burning the electrolytes. Matter of fact, most people haven't been eating electrolytes well, you know, and so add that constant eating and acid-ash diets on top of this. And then, so how do you hydrate? Because that's the only way you can open this up is get ionization going, get hydration going. What's the second way? Edema. Mm-hmm. And that's what you see. Water. Water is a universal solvent, right? Yes. So in comes the water to try to break things up, but it's stagnant all the way. The eliminative organs are stagnant. So the water has nowhere to go to break it up. It has nowhere to go. So it just gets more hypertrophy, and more hypertrophy.
Yeah.
Enlarged. You swell and swell and swell.
Yeah.
Kidneys. And it's always been that way. Some of your older medical doctors would be able to look at swollen ankles and go, kidneys.
Yeah.
Your newer guys go, well, I don't know what the hell that is. Why are those red like that? It must be poor circulation. Mm-hmm. Poor circulation is always blamed on all lymphatic problems when you see your red ankle swelling and you see your skin breaking down.
Discoloration.
Discoloration. That's your lymph system. It can pack the blood, but it's not poor circulation. It can't become that.
Well, the more restricted you get, the more those little capillaries harden, the more restriction of not just the lymphatic vessels, but the blood vessels as well.
Yeah.
That's where you start getting the poor circulation in the feet. You start getting the neuropathy.
The swelling starts shutting down nerve impulses, so you get the neuropathies. Absolutely. Then notice the neuropathies go away when you start pulling all the swelling out, the acids out, you start getting more neural response. Oh, look, my neuropathy's gone.
Now, for a while, that could itch and sting for a little bit.
Yes, it could. Yes, it could. Yes, it could. I know. Oh, yeah, you good point on that
Remember, just give yourself time.
Yeah. My concern in the beginning when I started working on quadriplegics was just that. Waking up a nervous system that has been suppressed, the pain of it all.
Yeah.
And there can become a lot of pain in detoxification in the regenerative stage. Strap yourself in, as Henry says, buckle yourself in, buddy, and head for it, because you gotta win the day.
Yeah.
It's you against the negative forces. That you come here, you're taught most everything negative now, and it's like you're now learning the positive, truthful sides of life, and you just have to grab a hold of that and let it take you to the heavens.
Yeah.
And it will take you right into Wellville. Might be some are going to be on a bumpy car, and others are going to smoothly ride their train. It's all karmic too. Each and every one of you have different karmic responsibilities that you have to deal with. So you have to add all that up and not be down on yourself.
Yeah.
Give yourself some good loving.
We had a hot tub one time, and my kids would go out in the snow, immerse themselves in the snow until they couldn't handle it anymore, and then jump in the hot tub. And this was at the age of 5, 6, somewhere around there, and they'd be like, needles, 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 because it was waking those nerves back up.
Well,
and if you've ever been,
exactly. You've been frostbit, you know exactly what that is.
Yeah,
exactly. I've been frostbit many times, but severely one time, and the pain when you hit the heat is beyond belief.
I will say, when that starts happening, lower circulation is the most amazing formula for that.
That's a good one to know.
Mix that with the adrenal.
Oh, wow, that would be good to know.
Because I've had neuropathy minimally, but still had it. And I started waking some of that up, and I would go to bed and lay there and think, I'm not getting sleep tonight. And I would go and I would do the lower circulation and the adrenal. Even though it would seem like the adrenal would wake you up, the combination of the two and the antispasmodic was really good.
Exactly, because I tell you, you can get, coming in from a frostbite.
Exactly.
Exactly. The reason why I need your help now is because my brother has been diagnosed with a disease of the blood called or bone marrow failure disorder. Okay. Bone marrow failure disorder. So let's go into the bone marrow a minute. What are we seeing in bone marrow? Oh, a bunch of cells. Oh, look, we got interstitial spaces. We have some matrix.
Yeah.
All right. So if you're having failure of bone marrow, you're having failure of what system? The lymphatic system. If you're having failure of the liver cells to function, what were you having failure in your lymphatic system? If you're having, you can go on and on and on, because when you, at the end of the day, when you take everything back to the wall, and you can't ask any more questions, you're at the causative cause of all things, you're at your lymphatic system, and you're at the acid side of the doorway of chemistry. 99.999% of the time. And we prove that by fixing that system, and in 99.999% of the time, you can win the game.
When you have an issue in your body, you go back to the acids, but the response of an organ is either going to be hyper or hypo. It's either going to get too excited or it's going to get too tired. And suppressed.
Exactly. And you can do that even in the acute stages. The acute stage can be a hypo stage, not just a hyper stage.
Yep, exactly.
Same with the subacute.
Exactly.
Chronic, I said chronic is always going to be hypo. When you're chronic, you're hypo. There's no hyper in chronic. And hyper always will go to hypo. Everything goes to death. So what's stimulated now, and the reason it's stimulated, will take you down the road the other way to the death of it. It's kind of like high blood pressure is low blood pressure.
Exactly.
Once you fix the kidneys and all that, guess what? Whoop.
Yep.
You're going down to low blood pressure. And then you're going to build yourself back up to the normal pressure. I mean, it's just...
Right.
So anyway, it's failure of bone marrow to produce healthy red blood cells, so we know that. This diagnosis was made because some weeks ago he had his right leg blocked at knee level by a thrombosis. That had to hurt. They could not operate because they found out about the condition of his blood. Is there any hope for him if he follows a raw vegan diet and gets a protein report? I'll tell you right
Absolutely.
now. When you wake up to a thrombosis, or you wake up to blood clots, or you wake up to anything like this, what do you immediately want to do? There's one thing you immediately want to start doing, and that is eating your fruit.
Yeah.
The fruit, not vegetables. Remember vitamin P and K? Not the vegetables. The fruit. That will start breaking apart blood cells. You want to bring alkaline chemistry, and I dare say you might even want to do a little bicarbonate in some fruit juice, and start bringing some alkaline chemistry to break apart those blood cells. Because if you look at live blood cell analysis, some of you got that done before, and you see how red blood cells either attach themselves, follow each other like choo-choo trains, things like that. That's what you don't want. And then when you notice that when you put enzymes in, did you notice how that breaks apart? That's your living foods. And it brings a certain pH to that blood.
Yeah.
At a certain pH, you've got sticking. At another pH, everybody goes to the individuality again. That's vital to that. So when you see anything like this, you're going right to the fruit. Now what's the other benefit? You start hydrating, you start ionizing, and you start astringing the lymphatic system.
Yeah.
Key.
Also, get on the blood formula, or else take blood purifiers or something as far as herbal goes.
You want upper circ, lower circ, your blood formula.
Yep.
Get on your fruit immediately, and get your kidneys filled, because it's going to take you back around this whole circle back to your kidneys, lymphatics, and acidosis.
Yeah.
Because those are the symptoms that all your cells and your fluids are going to go through under the acid sky. Yeah. So that's what I would be doing, and then get on the protocols, but go, like we said, the circulation formulas and things like that. Oh, well, you got to tell about the rooster.
I will, but I just real quick, I want to say, I was doing some research the other day, and I found a picture of the villi in the small intestine. Inside every little villi is blood vessels, blood vessel capillaries. But guess what else is in there?
Oh, yeah.
Lymphatic capillaries. And yet the lymph isn't important?
No. And then you got the lactose. Yeah. Oh no. Yeah. Oh yeah. How about this is good because it's about bone. It's in a way about bone marrow a little bit. It's also, I think, about parathyroid and whatever. But this is a good rooster story.
Well, let's finish.
Okay, let's finish this. Don't forget the rooster. We got to tell you about the rooster.
Got to tell about the rooster.
Good. The rooster's good. I am devastated with the news and would like to help him. Absolutely, guys. The prognosis is that sooner or later he will have to have a bone marrow transplant. And let me tell you, honey, they don't work. I can't even tell you the chemics and all the people that have had the bone marrow transplants. Yeah, ask a few of them. Yeah, there has to be. It has to be done. There has to be a bone marrow donor. You know what? Get him healthy. It's easy to pull him out of that. It's not difficult to pull him out of this. Not difficult at all. Brothers and sisters, most likely to be the best matches, of course. If I donate bone marrow to my brother, what are the side effects? I wouldn't. I would get his healthy. This idea, or you could give up one of your extra kidneys.
Well, there's also the reason of why is the bone marrow an issue.
That's important.
And so even if you give him a transplant, or give him some of yours, so to speak, you didn't solve what was causing the issue in the beginning. You only manage the symptom.
Excuse me.
You only manage the symptom.
That's why they don't always work either. You know, you have to realize, and this, sometimes surgeons, and I'm pro-surgeon, surgery, but sometimes this is why a surgeon gets beat up for repeated surgeries, because he's dealing in the same medium, the same matrix. He's dealing in the same acidic sludge that tore down the tissue in the first place. Even with the traumatized tissue, you're looking at the lymphatic system to clean it. So you're always looking at proper kidney elimination. You would never even hear any of this if man did not slip from a raw food scenario, from an islander consciousness into a northern, that sort of thing. We wouldn't be at this doorway now. But man has consumed things that other animals can't even eat.
Yeah.
You know, man is eating things that kills all the domesticated animals, and it's like, what? No, we haven't woke up yet. So it's really a time to wake up here, and it's obvious. You know, with the children going down so fast, it's not even funny.
To just end this, and I don't even know, maybe Robert wants to add anything to it, but I absolutely believe he can be helped. Absolutely.
It's not even. I don't even believe it.
Yeah.
I've got another word I use. I know it. Belief only gets you so far. But we've had plenty of cases, bone marrow, I'll tell you, cases where there's no platelets whatsoever. I can tell you one case we had where he was on a pharmaceutical, fried his bone marrow. I'll tell you, they couldn't find any bone marrow in him.
Yeah.
And I'm going, you couldn't find any bone marrow, where he's on blood transfusions every other day, I think, and platelets about every 3 or 4. I got him up to once a month and building, and then I didn't see him anymore. I don't know what his mother did with him. But they literally fried his bone marrow with pharmaceuticals and then, gave him chemo. It's like, what?
Well,
what are you doing, man?
This is the thing that's a little frustrating for counselors, is because people come, they start getting a little bit better, but it's not a cure. They're just seeing a little bit of improvement.
Yeah.
And they get tired of waiting, and so they quit. Well, wait a minute. What other choice do you have other than taking stuff to make it presumably worse?
Well, this is why I've taken the time, and when I started these videos, to educate, because there's so much misinformation and lies out there that I wanted to do these videos to clear the air, and whether people believe me or not. And at first they had a hard time. When we first started doing these videos, I got all kinds of crap on the fruit. You fruit? What would you say fruit for? I mean, I got negative stuff blowing back on me because I recommended fruit. Now look at all the people becoming superhuman on fruit.
Yeah.
Holy crap. It's like, what? Yeah, it's about time too, isn't it?
Yeah.
So, rooster story?
Okay, so I have...
Rooster story.
I'm taking my schooling for naturopathic for animals, and we here at the office have worked with cats and dogs and horses and all
Hamsters
kinds.
and snakes.
Yes. This was my first rooster story. The rooster, something was wrong with the leg, so that it wasn't able to use the leg. And because it wasn't able to use the leg, it would scoot on its rear end, and it lost its tail, so to speak. And the lady who owned it just thought, I wonder. And so she started giving it bone and connective tissue and superfood. And I think she said within 3 weeks, it was standing up on that leg and hopping up a hill and back down. And that was just in 3 weeks' time on a few things. That wasn't even going full spectrum with kidneys and things like that. That was just adding bone and connective tissue
and superfood. Isn't that an amazing story? What you can do with just a rooster like that? And
can you imagine a rooster that isn't proud with that tail? I mean, now we're giving him back his tail. That's his...
Yeah, his tail's going back. I know. I love these stories because the stories of truth and God and health.
Instead of cock-a-doodle-doo.
Exactly.
You'll get this tail back and he'll be like, cock-a-doodle-doo.
Yeah, as long as not some food on some plate. And here's another great story. And this is from Jacqueline Kennedy. Whoa, Jacqueline Kennedy. Said, I recently have begun healing the reasonable size burn from an airbag. They know these airbags are hurting and killing people, and yet they won't stop. You ever notice once you pass a law, no one will do, they just leave it in place whether it's a good one or not? That blew my skin open. Her airbag blew up and blew her skin open. Oh, gee, poor thing. I started healing it with aloe vera and Dr. Morse's burn salve that I keep in the fridge for a rainy day. Yeah, I do too. Thank goodness. This has me rethinking most people would go straight to the doctors and attend the wound. But because I had seen a video of his about healing burns, I was lucky enough to take things into my own hands. I really would like Dr. Morse to do a video on emergency healing alternatives so that people avoid making the mistake of going into the environment of the doctors, which affects your psychology, which is very true. Wherever you find yourself, the environment show your physiology. We must teach everyone what they can do in emergency situations and how to avoid being manipulated into medical practices. Can you ask Dr. Morse to do a video on burns and breakouts and cuts, etc.? One specifically just for that. I really should be on his website as a major video. You know, maybe I'll do that, but let's take a look. Did you see this?
Do you remember we talked about putting together a first herbal first aid kit?
I've got a first aid book. We used to have manuals, first aid. We have a first aid book this thick. We used to be really busy putting stuff together, but now it's like it's all hanging out there. We need to do that. Let me show you before and after. Before. See the skin hanging off? So that reminds me of two children playing up in Ohio.
Yes, I remember the
Remember
story.
That? And one was an Amish child and one was a non-Amish child. And they were playing with gasoline and they threw it on a fire, and everybody knows what happens when you throw gas on a fire. Not like lighter fluid.
Great job, by the way.
Yeah, great job. Oh, you know, I got stuck. I've got a lot of plants around my place, and so I got stuck in the eye with a bromeliad, which is not fun. And I just put raw burn salve right on my sclera there, and it just made it feel so good and healed it right up. If not, it would have been a torture. And then another lady had put a habanero or a ghost pepper on her eyelash up here. She had rubbed her thing here, and it was pain. Wasn't just hurting, it was severe pain. She tried butter, she tried everything in the medicine cabinet, and she said, well, here's his burn salve, I'll just try that. Stopped the pain immediately. She said, you need to market that. Yeah, but these two boys got in a fire, and it burned both of them severely. The Amish boy, it burned his whole left arm to the skin just fell right down off of, kind of like your skin is hanging off there. So, John.
Yep.
He kind of the Amish medical doctor. He cut the skin off, wrapped the arm in burdock leaves. So I'm sure he used aloe and stuff like that, but burdock leaves was his thing. So I was there. This was in Ashland, Ohio at the time. He now moved up to somewhere. So I was at his barn, at his place. And it was I was giving a discussion on health, you know, to a whole bunch of Amish in the community, and he had the two boys there, and you would not believe it. I could hardly see where the Amish boy was burnt. You could hardly see anything. It looked just like a normal arm.
Right.
The non-Amish boy was mutilated.
They've done so many skin grafts.
Scraps and skin pulls and stuff. It's like, why? Skin will rebuild itself. So I've always said, where the medical profession fails majorly, and I feel sorry for any of you that are in burn clinics, because this is ridiculous. If you're going to do anything in a burn clinic, you have a vat of aloe with burdock leaves and our burn formula. Look what's in it. Exactly. Well, John did come up with a burn formula. Before he didn't put burdock leaves in it, interestingly enough, and someone stole, you know, that bad thing happened to him on that. But the burn salves, I'm telling you, you do not want to treat burns with grafts and scraping your burns. I mean, this is insane. The pain. The thing of beauty about burdock and about aloe vera, it takes the pain right out.
Yeah, comfrey. It just soothes.
Mid-bone,
soothes.
Huge. The difference between those two levels of thinking is mimicked in those two boys. The one that went to the medical doctor, mutilated. The Amish boy could even see where he was burned. My sister did that.
Yeah.
Her little boy's whole coffee pot on him. Well, she ran into the hospital, burned 3rd degree, all the way, burning bad. So in the hospital, he was there for a few days, you know, and he's in the burn unit. And they're putting some cream on him. And my sister asked, what's the cream? And the nurse said, well, it has aloe vera in it. Well, I'm a healer at that time. It just clicked with my sister. So my sister got him home and used total just aloe vera. No scars, no nothing. Healed like bam.
Yep.
I'm telling you, that is so factual, and there's so many stories behind that it's insane to see the medical doctors not using that.
Yeah.
So good work, honey. Good work. Great work.
Absolutely.
What time? We got time for another one?
I think so. Yep.
Yep. Oh, it's 1 o'clock.
One more and then we'll be done.
One more. Hello, I'm trying to contact Dr. Morse. My name is Jose. I'm 21 years old from Texas, and here's my story. Early 2016, around January 1st, got the stomach flu virus. I threw up 3 times per session and had around 4 to 5 sessions of this. Throwing up hurt like a pain I've never felt before. Oh, wow. Interesting. Next day after I felt weak and tried, I guess, normal after being that sick. Day after that, I woke up with this dizzy, lightheadedness, pressure feeling that I felt that whole day. Did you go to a chiropractor and have your back looked at? I mean, when you start throwing up, you're racking that spine, brother. And you might want to do that because it can throw your spine out or tweak your spine and cause you some severe problems.
But if that's not the case, it could also be stirring some stuff up and shaking some stuff loose.
Absolutely. But that level of pain, I have to think. Now he's feeling his cerebellum. Mm-hmm. See, and I have to think that ratchets that, and you could have even, put some pressure up into the cerebellum here, and that was what you'd want to get out of there. Lightheaded pressure feeling that, yeah, exactly. I went on with the day thinking that it would eventually go away, but 2 days later I still felt it. So I went to the emergency room and they told me I had vertigo. All right, so right here, and it would make sense, but that would show me, of course, that you have a lot of acidosis, and you could have some parathyroid, given perhaps some weaknesses here within the spine and that sort of thing. But again, also, you could have a lot of lymph stagnation up here in the cerebellum, and you're just seeing, the response of all that action and all of that. The stomach flu virus caused an ear infection. Okay, so here's the thing. Let's look at it differently. You're still getting a stomach virus. You have to have stomach toxicity and acidosis for that to take place. But the same thing takes true in the ear infection. You have to have the connection. What's the connection between the stomach and the ear? The lymphatic system. That is the connection. Different cells, different structures, but the connection is the lymphatic system. The pipes connecting everything, blood and lymph. And that's your connection to these things. Yeah. And then, of course, the spinal column coming down with those tubes coming out, including the nervous system. Of course, he had to have a lot of pain with that, meaning you had to have something wrenched. Right. Something jacking on that lymph system. That nervous system. Okay, and that it should go away. Candle your ears too, my friend. You might want to candle 3 or 4 candles per ear. Start cleaning. Start opening up. Get your kidneys to filter. Start getting. Make sure your spine is straight. Go to a chiropractor. Make sure your axis is on properly. Because by throwing up, you could have actually thrown your axis off, and some people actually can just faint that way or go into seizures that way. So you want to be careful here. And then it should go away in 3 months. But your medical, you've got vertigo, it'll go away in 3 months. Sorry. It's a good way to collect $100.
Or more like 150.
Yeah. 150. And here, take this too, by the way. It's an antibiotic just to make sure. Yeah. I'm sure he got it for antibiotics because he had an ear infection. Yeah. Right? It had to be vertigo because he had an ear infection. Right. You have heavy lymph stagnation. If you have an ear infection, you don't have bacterial, you have what? We just talked about that. You have heavy lymph stagnation, but how's that tight? Again, viruses. Viruses don't take hold when there's no medium. They're proteins. Go back to that. I told them it's more serious than vertigo because I really don't feel the heavy dizziness. It's more of a lightheadedness, brain fog, and like a pressure feeling that I feel all day. Yeah, and this kind of head pressure can get really, really bad. Yeah. We've talked about that on other videos.
Neurolymphatic points are excellent to work on at that point.
Good point. Excuse me. Excellent point. Neurolymphatic points. Yeah. Front and back.
Help get this draining to pull some of that away from that eardrum and all that backed up lymph that's back up in here causing some of those issues in the first place.
Handle thy ears, work on thy neurolymphatic points, get on a fruit diet, get your kidneys to filter. If you have to dry fat, you go open. Sweat. Get yourself to sweat. When you're trying to open in a hurry, you only have a few avenues to do it. If you're not too edemic, squirt down the liquids, the juices, the fruit juices. Go in that way. Work on the neurolymphatics, handle the ears. Hot and cold showers, anything that moves, that opens up, that dilates.
Yeah.
I don't feel the heaviness. Okay. But they told me I need to go to a neurologist. Now the chain goes. Right? So I went, and they made me do an MRI. I hope not with contrast.
Yeah.
Results came back, and nothing was found.
Mm-hmm. That they were looking for.
Exactly.
They don't look at the lymph.
Okay, so when nothing's found, there's two things that it is. When nothing's found, there's two things that it is. Lymphatic and acidosis. When two things are never found, you're not going to see that. Sometimes they get me. We need to have an x-ray. Mm-hmm. You can't think on your own as a doctor? You don't know the body enough that you need to have an x-ray and put that patient through that? Stupid. We don't do vaginal exams. We don't do x-rays. We don't do anything here because we can tell you exactly what it is and how to fix it.
Sometimes people need those.
Yeah, I know. That's a good point. And sometimes people do need that. That's good. All right, so they wanted me to send me to do a balance test. I wonder what that was. No, I don't want to get that bad.
Wine in this hand.
Yeah, I don't. But I finally put a stop to it because these visits weren't cheap. I bet they had him running all kinds of things. It's like, all right, a balance test, what are we going to tell you? Putting you through all of this. For what? You're already telling them what you're experiencing. It's their job to tell you why. And by putting you through all this, they can't tell you why. It doesn't take them any closer to telling you, oh yeah, you have lightheadedness, or oh yeah, you have this. It's like, yeah, I can tell you that.
Yeah.
You know what I'm saying? It's like, excuse me?
Yeah.
I know. Days later, I started getting into the vegan diet that I was learning off of an internet because my diet wasn't the best at the time. Months go by, and this feeling is real light, but it's still there. Eventually, I broke my diet, and the feeling came back strong, like in the beginning. See how important, and this is a good example, how important diet and food is. Just the changing of the food changed his scenario. But he went to more of an acid diet, because, obviously that's what it is, and he felt it again.
Yep. Well, that just goes to show you that when you clean out, you're not just done. More's coming, because the body is always going to be getting rid of metabolic wastes and old cells and things that need to be removed from the body. It's just like, are you ever going to have a time where you don't have garbage at the house? And if you set that garbage, he was talking about Dr. Pimple Popper and the smell. If you set garbage out for 6 weeks and the guy doesn't go to gather it up and take it to the dump, you're going to start smelling it.
Yeah, how about 20 years of a tumor?
Exactly.
Having a tumor for 20 years. Oh!
Can you imagine opening that up and what that would smell like?
Yeah, I know. But this is real life. This is what's going on here. This is chemistry. This is physics. This is nature. This is how this world is put together. This isn't playing in fields of dreams, of theories that don't exist. This is what's actuality, like it or not, good or bad. Let me see here. But a month ago, and a half before writing this, I found videos of Dr. Sabai, so I got deep into what he was talking about. So then I'm taking his products, still feel the same, nothing has changed. The products aren't cheap. Yeah, you know what? I've got products too, and those products, they're only there to help you. And we try our damnedest to keep these prices down and down and down. And it's just that when our labs, and that's what pisses me off, we're at the mercy of our labs. And don't tell me herbs are always going up out there. But our lab seems to always like go up a little bit and go up a little bit. So we eat the profits or the loss for a while. I remember one time we lost profits for at least 10 years. I kept them at $18. I wasn't going to budge because people are, the way it is. Our gig is detoxification, and that's what those formulas are for, but it's a regenerative detoxification. We're about regenerating the human body, but it isn't about taking formulas. It's not taking supplements. You want to learn detoxification. The supplements you want to use has to be herbal. You don't want to use isolates. Any supplement that you want to use, it wants to be an herb that aids in your detoxification process, aids in the structure function of tissue. You don't want to think that's going after symptoms. Don't take herbs to go after symptoms. You want to understand what your symptoms are for. Herbs are classified as, in some countries, as medicinos and things like that to treat diseases. That's not what herbs were put on the planet for. Diseases doesn't exist in that realm of consciousness. Man created the illusion called diseases. So herbs are of structure function. That's why the FDA limited us to structure function claims by talking about botanicals. But they're also for fluids and the maintenance and health of fluids like the lymph and the blood. So these are our tools to use in the process of cleansing and rebuilding the human body. Period.
Well, not only that, but how you make a tincture, how you make a formula is absolutely so important, number one. These are the strongest herbs that I've ever come across, and I've been playing with herbs for a lot of years. And this is the thing. I have a lot of clients that decide to make their own formulas. I have nothing against that. But don't come back and say at the end of that this did not work. Because number one, I know how strong our formulas are. I know what our formulas can do. And I know, what they can do for the body. So if what you're doing is not working, or it's not working in as timely of a fashion as you would like, try something that's a little stronger.
Yeah.
Because just because you're making the same formula, you don't know the percentages. You don't know what goes into the formulas that are being made, the strength, the potency, the dilution, all of that.
The fairy dust. No, you didn't hear that. Little fairy dust.
Yeah. I'm just saying.
But it's true, and people have got into some of these formulas out there, and there's some very good formulas out there, I'm sure. But make sure your percentages are 1 to 4s in your formulas and things like that. 1 to 5 is a good formula, but that's the least you want. You don't want anything that's any less concentrate than 1 to 5s.
Yeah.
And most on the market are 1 to 7s.
Yeah.
So 1 to 6s. So we're back to 1 to 4. You can't get any stronger than ours without creating a medi-herb syndrome where you have to blow dry it again, and then you start really affecting the structures of chemistry, and this is without getting soup. Some of you find a little thickness in your formulas when you get them from us. Some lady was bitching that his formula's thick and it's got stuff in it. I'm going, send that to me, straight to me.
Yeah,
send
it back.
Send it back. No. We'll give you a fresh one. No, send that one back, baby. No, when you get one like that, you're at that bottom of the barrel, sort of. So you're at the goodies. You're at the concert, man.
Yeah.
Send that to me directly. I'll take it back. Absolutely. I'll send you one. Exactly. Somebody was bitching my guy. I'm going, what?
I opened one the other day and it had a whole bunch of leaves in it, and I just wanted to just chew on them.
Oh man. So that's what you're looking for. This idea of pharmaceutical purity and what's the word I'm looking for, where everything is set the same. That's not, you're going to find that in nature. Yeah. Every herb itself is individual. Its power is individual.
And it's not that we're downing Dr. Sebe's herbs or anything.
No.
That's not it at all.
I don't even know this.
Exactly. We're just saying that, you can't go back on us for something not working if you didn't use what we recommended.
Yeah. But when you lose anybody's products, know why you're using them, and that's why we're educating you. Know that you're after the kidneys, so you need kidney formulas. Know you're after the lymphatic system, at least one lymphatic formula. Know you're after the gut tissue, the GI tract, you're after that. Know you're after the endocrine glands. Know what you're after and why you're taking formulas. You're not taking formula for diseases. If someone's giving you an herbal formula for cancer, walk away. It's because we don't treat cancer. Cancer doesn't exist in our field. It exists in the medical field. In our field, it is cell mutation. It is what chemistry does to a cell. They use the word cancer to fill in all the hype and all the crap they've done to you, and to get the rights to then and then all. It's tied into a big deal. In reality, what is cancer stand for? What does it mean? And it means a damaged, mutated cell. In our field, it is actuality. In their field, they assigned these names to things and got everybody using those names. So then we figured out you're diagnosed with fibromyalgia. Yeah. Or you're diagnosed with lupus or some crap like that. What do you really have?
Exactly. Think about it this way. When you go to the doctor, you give him a list of your symptoms. He tallies those up and comes out and spits out a diagnosis. It's just a list of symptoms. Every symptom can be dealt with. You can reverse those symptoms.
What's funny to me is now, because of the lymph system is systemic, you're going to have a symptom in the gut. Kind of like I had the stomach virus and that caused an ear infection. That sort of thing. Where they're thinking you have different problems in different locations, when reality is you have the same problem, different tissue involved. Yeah. Same lymph, same acid, same mucus, same congestion, same everything. And the cells can go the same route. Acute, subacute, chronic, and then to the cancer side, the degenerative side. That's the process. And they have labels for it. We don't use their labels. You'll be so well off in life if you dump the whole concept of diseases and learn truth that cause and effect rule all of God's creation. So the question is, what's causing this symptom? And if you live in the world of fantasy of diseases and stuff, then you're going to throw that word out there. What does that mean? It doesn't mean nothing to nobody. So then they had to figure out, how do I explain nothing to nobody? Autoimmune. Then they start assigning other bullshit stuff, like it's in your head or stuff like that. And because it's like, that is a never-ending story that goes nowhere.
Or they start, on the allopathic side of things, they start giving you this to bring this up and this to bring this down, and they try and do the work of your body for you when they don't even understand the body. If you're on the naturopathic side of things, they start giving you this calcium to bring you up, this calcium to bring you down, this calcium to even you out. You're just managing.
Our side does the same thing, just like you said. It is the same thing. Naturopaths are not learning truth, and that's sad to me, because naturopathy is truly the science of nature. Chemistry and physics dominates nature as science, and you have to learn how that fits in the all of creation.
Well, let's just use, Hildy wrote that amazing article on B12.
B12.
On B12. It was an amazing article. But let's just say you take B12 and a certain amount of your symptoms disappear. Well, guess what? It wasn't a cure, because supplements will not cure. They will manage. It is the herbs and the diet that come in and encourage your organs and your glands to function the way that they were intended to function. That's what you want to do. You want to go out and enjoy life. You don't want to have to worry about whether this is high enough or that's high enough. One lady was playing with hormones, bioidentical hormones. She was taking this percentage of this and this percentage of that. And I'm like, all right, so that equates to this. But how do we know that that's what it's supposed to be?
What they're doing is looking at the stats of some unhealthy person that's got chronic adrenal problems, maybe chronic thyroid or parathyroid problems, and trying to balance out giving them those steroids instead of fixing the adrenals and fixing the parathyroids. They try to look at the steroid and using labs, and it's like you're using people that have no clue to what truth is. And when you're talking about a medical doctor versus God, someone who put all this together and the percentages and everything and healthy people, I look at that and I say our scientific community is, I've been in science most of my life, and our scientific community is okay, but is our scientific, I've been to other places, I've been around the God worlds, and I can just tell you, the human is such a narcissistic little creature. I mean, we can't even begin to understand this. We're just now bringing out the nano levels. There's sub-nano levels. There are you can't even, you just can't even go there mentally.
Yeah.
Yeah. So that's
well,
why.
it's like God said, to look on me, man wouldn't even be able to.
Exactly.
To even comprehend, we can't. We have to, most of the time, put him in a box so that we can even comprehend what we think is the potential of being there.
Remember, chemistry, that this world is already created, and that the family of chemistry is already set, and set in ratios and pHs. Changing ratios and pHs upsets homeostasis, and that's what man does. Instead of using products of nature, he uses the chemistry of nature and makes products. And that's part of the problem, is when you use isolates to make products. Now you have a product that has some kick to it. It either has an extremely harmful kick to it, or maybe not so harmful, but you still have that, like bleach and some other factors that we use in life.
Yeah.
You can get toxicity from these factors. And then unbalancing body chemistry. To bring body chemistry into homeostasis isn't something a scientist or a chemist can do. If you have low calcium and I bring in calcium, I'm just going to push your magnesium out. Calcium is only low because your utilization of it is low.
Exactly.
So I want to go to the gland that's utilizing that I need that hormone or steroid and see what's going on there. Bringing a homeostasis to the body is getting cells healthy to perform their natural functions set by the maker of them, not by some pseudo man who thinks that he knows what chemistry is. That I look at most chemists and they don't even know acidosis yet. You know, I told you that one chemist that thought he had alkalosis for years. You know, this is the way they're taught.
Yeah.
So even in our chemistry department, we have a lot of misunderstanding and a lot of theories. I want to finish this up before we get going. Emily clicked on one of your videos. Can't give up. I got plans of becoming a police officer. Oh, that's cool. I'm lost at this point. I don't know what to do. Can't give up. I got lots of plans to be a police officer. I'm already the eligible age, but this head problem is holding me back. No father. It's just my mom, my two little brothers. I didn't have a father either like that. And little sister in my house, and I'm just trying to give them all a better life and install some of, this sounds like a good dude right here. The feeling in my head never goes away. Listen, guy, this is vital that you get this. I can't even tell you enough how important this is, because this is an acid pressure. And nothing good comes from acid pressure, from macular degeneration to glaucomic pressure. That's where you're going with this, is glaucomic pressure. That's an acid pressure in the eyes. And then this is the CNS, it's the central nervous system. So then early dementia, Alzheimer's, that sort of thing can creep in here, even in the 20 and 30-year-olds, guys. So this is very important to get the head drained. Candle that ear, see if it'll give you some relief there. Work on your good point neurolymphatics down the back. Look at the videos there. You got to get into the high fruit diet. Get this thing astringed. You know, get your kidneys filtering. Sweat. Whatever you can do to open your doors and relieve this pressure.
Yeah.
It isn't a blood pressure.
Well, he mentions there how he was doing fruits and stuff, and then he changed it or something, and it all came back. Yeah.
Maybe
that was on the other one, but that just tells you the power of the fruits right there.
Exactly.
You get they get flow going. They get things moving. And then you stop them, and then you feel all of that. It's because it's still coming. You're still getting rid of trash. You just stop the trash guy for a while.
Okay, now that's another good point. Another good point. Is when you get into detox, you get on the fruit, they're astringent. All right, so you got hydration and astringent. Those are the two things that are happening to you. That creates an anionic fluidity, all the things you're seeing, right? But now you're getting things moving, and you hit it right on the head. Then you stop.
Yeah.
Your car is like slamming on the brakes. Now you've got everything hydrated and moving, but still the kidneys aren't open yet. Things are not open good. And now what you got going?
You get all that behind you.
You got all behind you coming down the highway.
That's right. That's right.
Oh, man. So that's why you get into some of these pressure things and some of these things that you have to kick it back up to that.
Yeah.
You got to get it back up to the high fruits and get yourself going and get the kidneys opened up until all that comes out, because it can get so bad you scream all the time, can't take it. You want to kill yourself, and we have some people who have.
Yeah, unfortunately.
We love you guys. Thanks
do.
for putting up with us in our videos and stuff. But anything to help you guys make it through this and not suffer so much, that's the name of the game. And we just love the fact that you're giving your hand out to others. We're hearing great stories from you guys and others that you've helped. They write in and say, oh, one of your YouTubers gave me this and helped me, and I don't have this anymore. Can you imagine what you guys are doing to this world?
Yeah. You know what? I just want to leave you with the fact that Robert said this earlier. Get into your warrior mode. You were created to be an overcomer, to be victorious, to fight the good fight. Get in there and fight that fight. This isn't the time to roll over. This is the time to bare your teeth, so to speak. We're fighting wars on many levels.
Many levels.
Many levels. And the more that you win your fight, the more you'll be able to help encourage others.
You will win your fight.
Absolutely.
When you put the power of you behind that, not your mind, the power of you, consciousness, your awareness behind that, because that is your power. You are your power, not mentally, not emotionally, but consciously.
Your healing is already there. You need to accept it. Many don't believe. When I start talking to them and they get to the root of things, many don't even believe they're worthy enough for the healing.
Oh.
You have to be able to accept the healing.
Exactly.
And you have to be able to walk it out in faith. Your healing has already been, it's there. You just have to walk towards it.
You know, the sad thing about what you were saying is that man has some pretty diabolical parts to himself. And I've seen parents tear down their children.
Yeah.
And raise them in an inferior mode, power over them and stuff like this, even from the mother. And it's like, at a point in your life, you have to assimilate that you didn't come from your parents, your body did. You came from God. Your body is what you're using that your parents genetically modified for you.
It's just a vessel.
It's just a vessel for you to use. And that's what you want to look at. Yeah, we're done right now. That's our thank you.
Anyway.
All right. We thank you
love
so
you.
much. We love you.
Thanks for listening.
Thanks for listening.